One of the most common decisions within health insurance is whether to go with a PPO or an HMO, or if you're on the marketplace, possibly an EPO. So let's talk about it in today's video. Now, as always, if you have questions about your health insurance, you can reach us at the number on the screen, or of course, feel free to contact us in the comments below. Now, we do release these videos on a weekly basis, so make sure to subscribe to stay up to date. And of course, please go ahead and click that like button, give us a thumbs up to help support this video and our channel. All right, thank you so much, and let's dive right in. So let's start with PPOs. PPOs are usually the most desirable type of plan because they offer the most flexibility. You won't need a PCP, which is a primary care physician, and you won't need referrals to see a specialist. So what does that mean? Basically, if you want to see anyone other than your general practitioner, if you are on a different type of plan, then you might need a referral, for example, to see a cardiologist or a neurologist, etc. And this can be difficult for a few reasons. First, it can be an extra visit, which often is just very inconvenient, and many people don't have time for that or are unable to get an extra day off of work. So it can certainly be very inconvenient to first have to see your primary care physician if they're unwilling to call in a referral without you making an appointment to come in and see them first. Second, this can mean more waiting to see your specialist. And maybe this isn't that big of a deal if it's a medical need that isn't extremely urgent, but if it is an urgent need, then first having to make an appointment to see your PCP, only to then get a referral to make an appointment with that specialist, could be more than inconvenient. Or even if you are somebody who has a better relationship with your primary care physician and they're willing to call in a referral without you needing to make an appointment right now to see them, you still have to wait for that doctor's office to call you back. And in a stressful situation, this just adds more stress. And then finally, you of course just have a little less control, or you might have less control dependent upon your primary care physician. Now, some general practitioners are wonderful and they really listen to their patients and take their wants and needs into consideration and are willing to make a referral for them to see a specialist, even if it's something that maybe wouldn't be their number one recommendation. But if you have a primary care physician who is a little bit more resistant, then maybe you feel that you need to see an endocrinologist, but they feel that your thyroid numbers are perfectly fine and you might meet a little bit of resistance, which again is less than pleasant. Now, of course, this is not always the case. It's just something that you might run into if you need a referral to see a specialist. Another benefit to PPOs is that you'll have coverage in and out of network. So again, it's going to offer you more flexibility. Now, on the flip side, of course, generally speaking, these types of plans have higher monthly premiums when compared to HMOs or EPOs. But generally speaking, the rules of PPOs apply across the board, whether we're talking about marketplace plans, group health insurance, private insurance, short-term medical plans, more on that in just a moment, Medicare Advantage plans, more on that in just a moment, and even dental insurance. And while we're talking about dental insurance, most people would recommend that you go for a PPO for dental plans. Now, when we're discussing medical insurance, it's going to be pretty easy to find at least a primary care physician who accepts your plan if you do have to go in-network. The same cannot be said of dental insurance. So if you do go with a DHMO, which is of course the dental version of an HMO, it might be a little bit more difficult to find a dentist who is in-network than you might expect. Additionally, and of course this is not always the case, but it is pretty widely reported across the board that many patients express dissatisfaction with their DHMO dentists. Very often they feel rushed, and that could be because of the way that DHMO dentists bill. It's just something that we've heard a lot of people express dissatisfaction with. So definitely, if you're looking into dental plans, and dental insurance in general is much less expensive than health insurance, you're going to give yourself way more options if you go for a PPO versus a DHMO. Now, switching gears back to medical insurance, if you are under 65 and you feel that a PPO is the way to go, they can be a little bit difficult to find on the marketplace. If that's the case, your best bet is probably an EPO, which of course we'll get to in just a moment. But if a PPO is absolutely what you need to serve your needs, then you might want to go for private insurance, which can be a little bit pricey, especially when compared to group health insurance or marketplace plan if you're eligible for a premium tax credit. But if you absolutely need a PPO and they are not available in your area on the marketplace, then you may want to look into a short-term medical plan. Short-term medical plans can be a great way for you to experience a more customizable, wider range of benefits at a lower price, especially if you are a younger, healthier person. So some of the pros to short-term medical plans include lower monthly premiums, especially if we're comparing them to a marketplace plan without a premium tax credit. Year-round enrollment, so there's no specific enrollment period. If you want to sign up for a short-term medical plan, you can do so today. Short-term medical plans also offer nationwide PPO coverage, which, as I mentioned, is very hard to find on the marketplace. And short-term medical plans are customizable. So because there are so many to choose from, you can really sort of pick and choose the benefits to make sure that your plan suits your needs. But on the flip side, short-term medical plans are not ideal for everyone, and they're not even available in all states. Now, short-term medical plans do have some type of medical underwriting, and if you have pre-existing conditions, they likely will not be covered in the first year of a multi-year plan. But if they are more complex pre-existing conditions, they may not be covered at all. And of course, pregnancy will not be covered by a short-term medical plan. And additionally, they're really not ideal for people with small children. And finally, Medicare Advantage plans also offer PPO options. Remember, Medicare Advantage is a replacement for original Medicare. However, Medicare Advantage PPO plans are still not as flexible as original Medicare with a Medicare supplement plan. And that's why most people still choose original Medicare with a Medicare supplement plan, and certainly most of our clients do. But if you are looking for a broader range of benefits than what is offered by original Medicare with a lower monthly premium, then you might want to consider a Medicare Advantage plan. There are pros and cons, which we discuss in other videos, and we will get more into that later in this video as well. Then there are EPOs, which sort of split the difference between PPOs and HMOs. And of course, they are much more common on the marketplace. So let's take a look at healthcare.gov. So if you're on healthcare.gov, in the glossary or the frequently asked questions section, you will see that they go into a little bit of further detail regarding EPOs, HMOs, POS, which is point of service, and PPOs. Now, unfortunately, the definition they give you for EPOs is really not very helpful. It indicates that it is a managed care plan where services are only covered if you use doctors, specialists, or hospitals in the plan's network, except in an emergency, which is what we also touched upon earlier. However, something else that you need to know about EPOs is that unlike HMOs, generally speaking, you do not need a primary care physician or a referral to see a specialist. So as I said, they do sort of split the difference in that you will need to be in network, except in the case of an emergency, like an HMO. However, like a PPO, generally speaking, you do not need a referral to see a specialist or a PCP. As always, we're speaking in general terms. Now, if you did want to see if there was an EPO available to you, then what you would do is basically go through the steps to get to the available plans. Right now, we're looking at the full price plans. There are no premium tax credits being applied here, so don't get scared off. And then over here where it says Add Filters, you would click here where it says EPO. So as I mentioned earlier, very often you will not find PPOs on the marketplace, and you can see that here that there are 116 HMOs available and 83 EPOs available. And then of course you would apply filters and you would see just the EPOs. And of course, looking at what we're looking at right now, there do seem to be a significant amount of EPOs available. And like the rest of the plans on the marketplace, you can find plans that are the bronze level, the silver level, gold, and platinum. And finally, there are HMOs. HMOs are the least flexible, but usually the least expensive options available. You will have to go in network for benefits for doctors and hospitals, and if you choose to go out of network, your benefits will not be covered. Now, the exception to this, of course, is a true medical emergency. So under the ACA, if you are in a true medical emergency and you need to go to the emergency room or perhaps receive inpatient care in the hospital after going through the emergency room, then you cannot be charged more for an out-of-network hospital versus an in-network hospital if you have to go through the ER. So if you are in a medical emergency, please don't look for the closest in-network hospital. You need to get to the closest hospital, period, because balance billing is no longer permissible. With HMOs, you will need a primary care physician, and you will need a referral from said primary care physician in order to see a specialist. Now, of course, there are many HMOs available on the marketplace, and generally speaking, if you have group health coverage through your employer, you'll usually have an HMO and a PPO option to choose from. And then, of course, there are many HMOs. They are quite plentiful as far as Medicare Advantage plans are concerned. As always, if you have any questions, you can reach us at the number on the screen or in the comments below. We are licensed nationwide and there's absolutely no charge for our services, so please feel free to reach out. We know health insurance can be quite confusing, which is why we release these videos. So definitely make sure to subscribe, that way you stay up to date. And please give this video a like, click that thumbs up button so that we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.